This is a webinar we've talked about doing for some time. There have been, I don't know about you all, but I have felt just like it's been all COVID all the time on news sources and in everywhere you look, there are these questions about how's everybody doing, how's everybody dealing with it, but mostly in our field from the kind of behavioral health organizations around treatment and so on. And so this is a conversation that has been happening certainly nationally, but we wanted to kind of bring it down to our state level and just be able to share kind of our experiences and practical ideas and thoughts that we've had. Again, hopefully we'll have a few more folks chime in along the way, and questions and comments are certainly welcome. And I think I'll ask Justin to just keep an eye on the chat, maybe if anyone wants to use that tool as a good way to kind of interject, but certainly we'll open it up here in a little bit and give people an opportunity to share. So I want to just briefly introduce you to a few folks. So first of all, WAQRR has a new staff member, and that is Justin Cram. And Justin is has been with us for almost a month now, and or maybe a little bit more than a month. So he's just now getting his feet wet. One of his big jobs will be putting together these professional development opportunities for WAQRR, as well as helping us in the accreditation process. So as people enter that, he'll help kind of move those processes along. And Justin has, again, the distinction of being our very first employee. So we've never had anyone to ask to do something before. We always had to do it ourselves as a group of volunteers. So it was a good day when Justin came on board. So Justin, welcome.
Thank you. Glad to be here.
And then Jason Bliss. Jason is really great to have you with us. Jason is a regional state coordinator for Oxford House Incorporated. His areas include Washington, Montana, and Alaska. He has been in long-term recovery since 2010 and has been working with Oxford House since 2011. He serves on several local boards, including the Benton Franklin Recovery Coalition and with Merit Resources. He's coordinated with substance abuse organizations, county housing organizations, law enforcement, drug courts, CPS, and the Department of Corrections to build and maintain a strong recovery network for our community. So Justin is he's got his hands in all of those, Jason has had his hands in all of those things for some time, and we really enjoy a healthy, good collaborative relationship with Oxford House, and Jason is a big reason for that. So Jason, welcome.
Thank you, Alan.
Travis Gannon is also joining us on our panel, and Travis is a recovery residence provider in Snohomish County. They have essentially 5 residences. They serve men in the county. He's been at that for what, 4 years now? Is that right, Travis?
Yeah, getting close, right? 3, something like 3.5, something like that.
So started that, and Travis represents a large group of our number who are really doing this in some ways kind of on the side, meaning he's got a day job. He is holding down this recovery work, his vital presence in his community, on top of doing all the other stuff that he has to do to make his livelihood work. That said, he has developed a really good, trusting relationship with Snohomish County and with the cities there, and so has been just a really good model provider. Travis also sits on our board of directors at WAQRR, has been with us since the very beginning, one of the folks saying, hey, we've got to do something about both the quantity and the quality of recovery housing in our state. And so Travis has been a real ally in that work. And so thought it would just be interesting to have this conversation with an on-the-ground provider that sort of day in and day out is in the house, and then with Jason, who has maybe a little bit of a 30,000-foot view of what's going on in Oxford statewide and beyond. Thought it would just be really interesting to have both of those perspectives as we dive into this conversation. So, and I am, I think I know all of you, I'm Alan Mua, and currently the chair of the Washington Alliance for Quality Recovery Residences. And one of our tasks is to just host these kinds of conversations so that when there are new trends or things that are going on in our state, we really want to be there to open up the dialogue about those. So so we're going to dive into this. I've just put a few questions together to kind of prime the pump, and I'm hoping this will be pretty conversational. So I guess I want to start off just kind of on the super local level and kind of work our way out. But I think I'll start with you, Travis, and just ask in general, how have your residents, do you think, been impacted by the current crisis? And by that I mean both the disease itself and or of course the shutdowns and loss of employment, all those kinds of things. What are you seeing on the ground from your folks?
Yeah, we're really running into we had a pretty rough July as far as things go, and really it's three main issues that I think that we're facing from a house level. One, isolation. It's our guys have been pretty much cut off from treatment services outside of Zoom and those kind of things. They're not able to connect with sponsors and 12-step meetings as much. They're opening up a little bit more, but that's a struggle. The part two of it's really the employment piece. From a standpoint, we can get into the numbers a little bit later, but we've had we kind of have a staged program. After a certain amount of time, we're asking for unemployment. We had our highest unemployment rates in the history of our organization of guys that are kind of on that time frame that need to be working. And the third piece is relapses. We had a record relapse month, unfortunately, in the month of July. So those are the three main areas I think that we've had our biggest concerns is in COVID so far, with COVID.
Alan, you're muted.
I don't think he realizes that yet.
There he is.
There we go. Sorry, it looks like I couldn't unmute myself. Usually I can't mute myself. Anyway, it's an opposite problem. Jason, same question to you. What are you hearing from your residents and house presidents and so on in your organization? How's it going?
I largely concur with the things that the same points that Travis has brought up. COVID and the pandemic as a whole it has been rough, not only on the residents and the houses, but my staff. It's starting to require a lot of ingenuity on really digging in and finding different resources. The lack of there's been an NA, there's been AA, Celebrate Recovery meetings that have been out there, but as we all know, 90% of them have all been done through a virtual basis. And for individuals, especially the individuals that are new into recovery, they get accustomed to going to those AA and NA meetings. They get accustomed to actual physical contact, being able to go to a meeting, give somebody a hug, sit down, share a cup of coffee with somebody. And those things have really, the inability to be able to do those things is really starting to take its toll. I've seen a big uptick, unfortunately, in suicides in the houses. Unfortunately, we had a gentleman take his life yesterday in one of our homes in Vancouver. Richland, Washington is home for me. Going back 60 days ago, I had 3 suicides in the homes, all within 30 days.
Oh, wow.
And I'm not even with having 336 homes, I usually don't deal with anywhere close to that amount of death or suicide in the homes. Yeah. So I know it has been taking a huge toll a huge toll on the individuals in the house, where they've been able to go out and attend, like I said, these face-to-face meetings, or reach out and get the face-to-face mental health meetings, the mental health support. Though telemedicine is improving greatly, it has over the past few months. The effects and the ramifications of COVID have been very, very, very substantial. I have the house, my staff regularly reach out to the chapters, be in contact with the chapters, who are in turn in close working relationships with the houses, much closer than we have been in the past, just to try to help and be there in more of a presence for the individuals. It's when the individuals can't go out, like I said, and socialize, attend down here in Tri-Cities, the summer for NA and AA months are just full of phenomenal activities. Usually they're in the parks playing softball, they're in the parks playing volleyball, boating, barbecuing, just general socialization, and that's it's been really hard as a result of not being able to do it. Again, as Travis touched on a little bit, the amount of relapses that we've had have grown exponentially, far more than we're accustomed to. It's been staggering to see the amount of relapses. One thing that I've noticed as well, I work very closely with a lot of treatment agencies. I've been doing this now for a while, and where I was getting, I would say on average, about 7 calls a week, just from random individuals, not so much in Oxford House, but parents saying, hey, my son or my daughter is ready for a change. Which direction I go? Where can I get them in for an assessment? They finally reached rock bottom. Those phone calls, for some reason, have just dropped off exponentially as well. Wow. Can't quite put a finger on it. You would think with everything that was going on, a lot of the individuals would be wanting to reach out and to get into our recovery homes, but it just simply hasn't been the case. I think here in the next few months, it's going to be just the opposite. We're going to have so many applications and so many individuals that are going to need housing, that are going to need help with treatment services. But right now, as a whole, from what I've seen, it just really simply hasn't been the case.
Yeah. That's really tragic. I'm so sorry to hear that, Jason. I wasn't aware of, I mean, I knew that suicidality is up in general, but that you're seeing it here locally is really a shock. I mean, it's just, it's like a punch in the gut, isn't it? Yeah. How many cases, Travis, have you had any cases confirmed in any of your houses?
We have not yet.
Okay.
I'm sure that we will. We went, and I know this is one of your questions, we really tightened things up from as much as we possibly can without overstepping our reach as a provider. We did our best to tighten things up as soon as we went into stay-at-home order in Washington. I'm sure we're going to have one. I think statistically it would be naive of me to think that we're not going to get one eventually. But up to this point, we have not.
And Jason, how many in Oxford so far?
We've had a few cases, Alan, but
okay.
To be honest, as a whole, we've been doing pretty well. We had the first case in Oxford House on July 11th, and in total, we've had 13 positive cases that has affected 10 houses. One house we had 2 positive cases, and another. I want to say one house we had 2, and another one we had 3 positive cases. But all in all, with 2,862 beds in the state of Washington, I've been pretty blessed. Fortunately, the 13 individuals that have contracted the COVID have all made it through it, have all recovered, and have all made it back to work. So in that sense, I'm even more blessed.
Yeah, I was thinking, as Travis talked about this, statistically speaking, you've got that many residents and that few cases is pretty remarkable. That means that there's some things going on there, which kind of leads me to my next question is, what have you guys done in your homes to either policy-wise or otherwise that have, sort of from the beginning in order to prevent the spread? What have you done? Travis, I'll go back to you just to kind of stay in order, I guess. What did you guys do policy-wise?
Yeah, so we limited outside guests during we're kind of following a phase by phase direction from the governor's office and really trying to limit exposure outside of the home. So we eliminated outside guests, and when Snohomish County moved into a phase 2, we opened that back up. I'm concerned that's probably going to be where we're going to get snagged up, but I've got a bunch of millennials and younger guys. I mean, broad spectrum, but most of our guys are 20 to 35. I think our average age is around 33, and that's our outliers weigh that kind of heavily, but the vast majority of our guys are in their mid 20s. It's hard to keep men in their mid 20s isolated at home. So, but we did, and they were pretty responsive to it. We stepped up our PPE. We made sure there was a lot of additional cleaning supplies. When this thing first cracked open, I mean, you guys were all shopping. We just finding disinfectant and Lysol was damn near impossible. So really, what we did was we upped our chore schedule. We bought, we resorted to just flat out bleach and diluted water. We went to a heavier cleaning schedule. We didn't fill some rooms that were, set up for multiple occupancy for a little while. Those were the main steps that we took. For the most part, I think that kind of covers it.
Jason, did Oxford kind of have a list of policy changes that everybody followed, or was it sort of house by house, or how did you guys manage that?
We kind of implemented it when this thing first started, and the governor had his stay home, stay healthy thing in place. We implemented across the board, across the whole state of Washington, Alaska, and Montana, that there would be no overnight guests, no visitors at all would be coming over to the house, visiting at the house, staying the night. And again, this was kind of tough for some of our residents, but we didn't even allow members from one Oxford house to travel to another Oxford visit, just to try and slow the thing down as much as we could. Things have changed a little bit as different areas in the state are in different phases. We've been working very close and following the recommendations not only of the CDC, but Ensley and also the local health departments. We put some policies in place for the individuals if and when they do test positive. If one member in the house tests positive, all members must self-quarantine for 14 days.
Wow.
One of two things, they're either allowed to stay there in the home, or if they choose to go to another stable, supportive place, they can go over there for 14 days. But we do not allow any in and out privileges for that 14 days, and definitely no guests are allowed. All of the members of the home must go down and must be tested. If there's any member in the house that tests positive and they happen to be in a shared room, in Oxford House, we have 1 or 2 shared rooms per house. Then we immediately do some shuffling around. We give that person a single room that's closest to one of the bathrooms. So basically, they're just going from their room to the bathroom, and they're the only person that will be using that bathroom. The other members of the house step up and do all of the cooking for that individual. The food is prepared. It's taken to their door for them to be able to grab and to be able to eat. The chapter officers or my outreach staff go and do all of the grocery shopping, the picking up of medications for the individuals in the house or stuff for their daily needs. All of that stuff is left on the door, on the front doorstep. Masks and gowns are definitely provided, and PPE through all of the local health departments. So all of that is provided to all of them that live in the house as well.
Yeah, so that's and can I just ask, how were residents respond? How did they respond to those? You know, some of those measures are pretty tough, especially if someone's infected in a house. How is it going? How are they responding?
To be honest, Alan, I've had very little pushback after being. So, you know, I'll immediately sometimes get the calls, Jason, I'm not doing this. I'm not willing to do this. I don't want to do that. And I say, I get it and I understand. If you wish to remain a resident in an Oxford house, you can either choose to follow those policies there at the house, or I will gladly let you go over to mom, dad's, wherever, as long as it's somewhere safe, so you have a positive support system. We don't want people to have to be captive in their own home. If they've got somewhere else safe to go and they would rather go there, we have no problem with them going there. Like I said, as long as they're under the understanding that there will be no in and out privileges. And if somebody from the house or chapter calls them and requests a UA from them, that they be available, and somebody from chapter will go and meet them to give them a UA.
Okay. And then for both of you, Travis, have you said you talked about maybe a phasing approach to sort of letting off or sort of returning back to quote normal, whatever that's going to be. Have you been able to sort of relax any of your policies yet since you moved into a different phase?
Yeah, you know, I mean, obviously with phase 2, we now have outside guests are allowed to come into the house at this point. So that's been the one kind of big change there. The guys are pretty cautious. You know, we're dealing with a demographic where there's generally, you know, some underlying health issues as well per house. We usually have 2 or 3 guys that, you know, have lowered immune systems and things like that. And we want to make sure that, you know, that their voice is heard and that their housemates understand that, you know, this is not something that they can play around with. And, you know, they've actually you know, I'm not surprised, but they've self-governed themselves pretty well in this regard.
Yeah. Well, nobody wants to go through what Jason described, where we all get a 2-week vacation from, you know, I shouldn't even make light of it. It's not vacation. It's pretty tough. Quarantine is a really impactful thing. So you find that your residents, in order to avoid that, are being pretty responsible.
Yeah, you know, I mean, the biggest feedback I got really was, you know, with new guys coming into the house, that, you know, there was more of a apprehension about us bringing in new people than I ever did. Hey, has this guy been tested? That's loosened up a little bit, but the residents were really concerned, I guess, you know, and I had several phone calls and you know, it was we had to go through this whole thing of, you know, you guys are a family unit at this point, you know, and you know, you guys are living together, and you know, obviously we want to take precautions. We're asking our referral services, you know, where has this person been, you know, have they had any symptoms, and we've had pretty good open lines of communication there.
Sure, great. Jason, anything change, or are those policies all still in place, the original ones?
Well, they've, as Travis brought up and talked about, things have loosened up in, I want to say, different areas of the state.
Yeah, right.
Over in Snohomish, King County, up towards the Canadian border, on the Idaho border, things have loosened up, and they're in different phases. Some in phase 2, some areas are in phase 3. So they have been able to have guests over. Some of them in phase 3 have started to allow some individuals back over there to stay the night and such.
Okay.
But and in some of my harder hit areas like Yakima County and down here in Tri-Cities, I think we're what is called a modified 1.5.
Yeah.
Guests are able to come over to the house on a limited basis. If it concerns children coming over to the house, CPS, the different organizations that we partner with that provide services and such, we've let up on that a little bit, and I think the residents are doing a much better job in policing themselves in what they're allowing and what they're not allowing. Travis again brought up a very good point. A lot of the individuals in recovery are millennials in their 20s, very early 30s, and I heard it all from, it's a Democrat thing, it's a Republican thing, Ensley's this, Ensley's that. It just took a lot of education on the part of myself and the part of our staff to say, look, guys, this isn't a political thing. It's not a political thing at all. It's taking lives, it's injuring people, and we all need to work together to keep each other safe. And I think after that kind of hit home, that there was kind of a turnaround and not as much pushback, I'll say as there initially was with some of the millennials. But I guess to answer your question directly, yes, some things have changed, some things have loosened up a little bit, but we're definitely not having face-to-face chapter meetings. We're definitely not having face-to-face state association meetings. All of those meetings are still done via Zoom, and unfortunately, but we're just not to that point yet where they're having social gatherings and unity events in the backyards. We used to really encourage that, especially in the summertime. 4 and 5 of the houses would get together, perhaps at one of the houses that would have an indoor swimming pool, in-ground swimming pool. They would get together and barbecue, all socialize. And I just received a call yesterday from a house. Hey, is this allowed? Can we start doing this? No, and unfortunately, we're just not to that point yet.
Yeah, you bring up a really good point, and we've certainly seen that here around the politicization, I guess is the word, of this issue. And in our culture, there's so much pressure for everyone to have an opinion about everything, and for especially just the kind of everything is polarized. So whether or not you wear a mask, whether or not you adhere to standard, unfortunately seems to have more to do with a political belief than with a sense of, or can anyway, with a sense of protecting one another. So I think we've all had to just remind everybody, okay, let's try not to be political about this. Let's try to be aware of our housemates and who lives here and how we can best protect each other. And as you say, it's been a bit of an uphill struggle, I think, for some folks to sort of keep that bigger picture in mind. I want to switch gears a little bit, and you alluded to this a little bit earlier, Jason, talking about kind of the personal toll of all this. I've really appreciated it near the beginning of the crisis. Somebody in recovery housing circle nationally reminded us that we don't want to be about social distancing, right? We want to be about physical distancing, which seems like a semantics kind of thing, but I really resonated with that to say, boy, all of us work so hard to remind people that you can't do recovery alone, and you need to reach out, and you need to have support systems. And the biggest struggle for so many people, especially in early recovery, is sort of getting over that hump to connect with people on a deeper level in a way that's going to save their lives, right? And yet now the message is, hey, be careful who you talk to, and everything sort of course, everything physically sort of shut down, meetings especially. The fellowships aren't having in-person meetings, except for there are some rogue ones out there that are happening. But in general, it's all online. And as you mentioned, Jason, for some people that works great. For others, boy, it's a real challenge. They just don't connect well that way with each other. And so anyway, there is a question in here, believe me, I'm done preaching, but it's a real challenge. And so my question is, what have you guys seen as effective, or how have you been able to help people connect? The obvious answer is get them on the Zoom account and connect them to a meeting, but other ways that in this really challenging time of really what can be social distancing and isolation, how do we get people to connect with each other in ways that are life-saving and literally prevent them from suiciding or from isolating and moving into returning to use? Big question in there. I'll start with you, Travis. Again, any thoughts you have about ways that you've been able to keep your guys connected?
Yeah, you know, we've tried a couple things. The one that seems to stick is we upped our, you know, generally speaking, our guys had a certain amount of recovery activities they needed to do a week, and part of that was, you know, a 12-step meeting or of some form, and we generally had one of those a week allowed per house, so the guys didn't have to leave and kind of do one internally. Now we've given them free reign to do them as much as they'd like to do. We try to get a little bit of our alumni association, which is very loose. When I say association, it's me calling guys that used to live with us that are, you know, I still maintain contact with, you know, try to get them a little more engaged. But, you know, it's how do you get them engaged? It's, you know, we weren't able to have them over to the house, things like that. So it's a real challenge. And for us, I haven't felt like I've got a ton of great answers, honestly, unfortunately, on how to connect outside of the house right now at this point.
Big challenge. What would you say, Jason? Are houses coming up with strategies to keep people connected?
A few, and Travis, I don't want you, I don't want you to feel at all bad that you it's personally been something you've been struggling with your house. I think it's all of us providers.
Universal.
All
right.
of providers have really been struggling with it. The house, of course, mandates people to attend, be working a program of recovery of some sort. For some people, they'll say, well, I'm not able to attend my treatment provider meetings anymore. I'm not able to do group. Some don't even have the idea of what Zoom is, more or less the capabilities of it for NA and AA meetings. I think a lot of it has been in the particular houses for individuals that need help. They need recovery classes. Telemedicine has really grown since this pandemic first started. There's a whole lot of treatment agencies out there that are offering IOP groups, that are doing OP groups. It's possible now to get online assessments done. It's possible to get assessments done via the telephone. Zoom, I know that we talk about it, and we really hit home on it today, but Zoom seems to be the primary thing that individuals are doing. Perhaps not, sometimes not just by themselves. I've had whole houses that will get together and they will attend a Zoom meeting. I've been hearing from different houses in different areas that they've been really, Facebook has allowed them to really broaden the Zoom meetings that they attend. People from Washington have been attending Zoom meetings down in Texas. They've been attending AA meetings from down in Florida, from just various different places due to Facebook. I personally am not on Facebook, but I hear from a lot of my staff, and a lot of my staff shares regularly just different Zoom resources and such that are out there and available. The holding of house meetings in Oxford houses, some of them have went from doing one weekly house meeting to doing 2 weekly house meetings for no other purpose during the second one than to do a weekly check-in to say, hey, I'm going through this. I have this stuff that's troubling me, so they can all work together to help each other get through these trying times. I wish I had more information to share with you all, but as of now, that's what our residents have been doing to get through this time.
Yeah. I'll chime in here with an answer, because our operation is a little different than Travis's or Jason's, in that we're staffed, and so we have the opportunity because of that to really pay attention to just on the ground, having somebody who is literally paid to be there and to just be in touch with people. There are some folks who, as you all know, have been kind of training for this all their lives. Just being by themselves and isolated is kind of their normal thing. And in recovery, they've had to trying to learn to do something different. And so for those folks, that this transition hasn't been as tough, even though we're continue to try to get them to connect. For folks for whom just those connections and seeing people in person is just sort of the center of their recovery program, this has been a major shift for them. And so we have just been learning to look for changes. You know, even in the suicide prevention world, they say watch for patterns that change significantly. And so we're just trying to really hunker down and do that, and ask our staff to just pay attention to little things that might seem like little things, but they're shifts in behavior, they're shifts in attitudes, or just kind of ways of being for residents, and they sort of slide into. So a question we just continue to ask is, what are you up to? How's it going? And asking people just about their plan for the day, even if folks who can't work now or choosing not to work because they don't want to be exposed, or they have weak immune systems, or whatever, all kinds of reasons. And boy, that's a real, it's really a blessing to have people who are there to look out for them. But there's some folks who, even with that, have really been struggling to find connection. So I just think that's one of the most vitally important questions we can be asking in all of this. And I appreciate, Jason, that in your first answer, that's what you led with, is this is really hard on people who are looking for connection. And I think it's right on. Let me switch gears again, if it's okay, and we can return to any of this in open conversation. But how has this been for folks financially? And I guess both at the resident level, but of course that trickles up to those of us who are receiving people's program fees and rents and so on, and maybe even working with landlords on the other end, trying to make our obligations. Jason, I'll start with you this time. Are residents having a hard time paying their rent? And if so, how does that impact you guys as trying to keep things afloat, housewise?
Absolutely. To be honest, the month of August is really been the first month that I have seen and noticed it really taking a hold and starting to take a toll on some of the houses and the residents.
Okay.
When all of the stimulus checks first came out, when individuals were seeing the extra $600 in unemployment, where there were a lot of programs, county-based programs, state-based programs that had an influx of money, and they were able to help individuals. We made it through the first couple months, and everything wasn't too bad. We had a few members, maybe sporadically, in a few different of the houses that weren't able to come up with the funds, but the house had some money set aside in savings, or kind of our matrix is set up in an Oxford house that if the house is completely full, the last person's rent that they pay is able to go into a savings account.
Yeah.
If we're down one member, we basically break even.
Mm-hmm.
If we're down two members, then of course we're there. Then the house is starting to struggle a little bit financially. Mm-hmm. So fortunately, with money that individuals had, the houses had put off into savings, or with the various different programs out there, unemployment, as I said, things went pretty well.
Yeah, good.
I've kind of had my finger on the pulse as we're getting close now, 10 days to the end of the month, and rent is going to be due to all of our investors again. In the last, I want to say in the last 48 hours in Yakima, in Tri-Cities, the chapters have had to make, I want to say, 4 $1,000 loans and one $1,500 loan to another house, just to be able to see to it that our bills are able to be paid. To touch a little bit on the landlords, fortunately for us, we've been able to get all of the payments made to all of our investors and our landlords, and that still remains job one for us, and still one of our top priorities to get that bill paid first. But I'm starting to feel, I guess, a little bit, it is starting to take its toll. Like I said, just here in the local area, with a few $1,000s that we've had to give out, I'm going to be having a meeting with the rest of my staff, and I'm sure that is going to be a trickle down effect. Fortunately for Oxford House is set up in a way that anywhere from 6 to 14 houses belong to a chapter. Those houses pay chapter dues every month to that chapter, so they have a strategic reserve, and then the chapters as well pay state dues to the Washington State Association of Oxford House. So for us, we're fortunate in that aspect that there's some strategic reserve there that we can tap into. But I'm hoping that we're able to get this thing turned around and I realize that we'll never probably be back to what we all call as normal before this thing hit. Yeah. But I'm hoping that we get back to some sort of normality. I'm hoping that the individuals that I know from lack of my personal contact just with members of the community that are in desperate need of treatment, that they need to get into treatment, that they need to get back into sober living, into our homes. I'm hoping that sooner or later that turns around. But my initial assessment of this month and what we're facing, I'm cautiously optimistic, because if this continues to go up and the houses continue to need loans to keep houses full, it's not going to be good for any of us.
Yeah. Well, what a great thing that you have some systems in place that at least so far are buffeting and keeping houses going. That's really wise. Stuff happens, and this is a great example. So how about you, Travis? Obviously, on the smaller operation, your margins are pretty tight, and how is it? How are residents doing, and then how is it impacting you?
Yeah, it's well, there's a couple ways here. Cash flow in from county outside, referral agencies that are actually paying rent, and then we've got private rent as well. I would say, for the most part, the only thing that we've really experienced is a slower turnaround time from our state and local agencies as far as when they're getting reimbursed. And then in turn, we're getting reimbursed, anywhere from 7 to 15 days later than we usually do per month. We don't push too hard there. We'll send some follow-up emails. From a private standpoint. We've been okay. I'm starting to see a little bit of similar to Jason. Really, I've got a couple people that are struggling right now. Real quickly, so our program set up in phases, and the first 2 phases are really sponsor home group. Most of your needs are being met by county and local resources. And then months 3, 4 are what are we going to do moving forward. Month 5 is really employment. So out of that group that had been there with us for 5 months, we stopped taking full amount of resources from county and city agencies. Generally, in a normal market, after 5 months, the resident is required to pay some of their own rent at that point. So we had out of the eligible people that are able to work with no medical or underlying conditions after that 5-month port, our unemployment rate is generally around 7 to 10%. The month of July, that unemployment rate was 75.
Wow.
So it was a massive uptick, and really we went to a weekly tracking system with our guys that were able to work. It was a monthly check-in. We require our guys, they needed to do 5 interviews a week or 5 job applications a week. There is work to be had out there right now, and so we really, we had to have that accountability conversation and do it with empathy, which is a challenging thing for us. Luckily, within about a 2 to 3 week period, we went from 70% down to, I think I have to double check the number. It was around 20 to 30%. So we significantly reduced our unemployment rate, which was a good deal. We've got a couple of people that are still struggling. But that's kind of been our strategy for the most part, is really, actively pushing into employment. And we provide resources, whether it's, word of mouth, job opportunities, things like that. But we're trying to bring solutions and optimism to the table as much as we can. So hopefully that answers that question.
Yeah, thank you. I guess I want to, I'm not sure I've asked the right questions to the two of you. I wonder if there's anything that you would want to throw out there in terms of other things that you're keeping in mind in the midst of all of this, or something that we haven't touched on that feels like is really important for the conversation. And then I want to open it up to our other participants just to see if there are other comments or questions, other things that you all are thinking about. So I'll again start with Jason, and anything that you feel like you just want to add to the conversation that I haven't asked you about in terms of what's important.
Alan, I think you asked some very, very good questions. I hope the answers that myself and Travis have given have been thorough enough for you all. One of the Oxford House kind of takes an approach. One thing that I've had to adjust a little bit and be reminding my staff of. Usually Oxford House will open a house on houses on an as-needed basis, meaning if the houses aren't full or darn close to full in a geographical area, we just don't pull the trigger and open a new house. With the things that with the unstableness right now of the amount of relapses, the amount of people moving in, moving out, the uncertainty of our economy. if the additional, whatever they're proposing, the additional $400 to $600 on unemployment is going to start to be offered again. If we're going to move to different phases, we've really had to sit back and do a lot of extra analyzing of the areas in the current situations before we approach our investors to open new houses. But I guess one of the important things is to definitely keep the word out there for in your communities and for your other investors. I still get phone calls from time to time from different agencies. Are you guys still open? Are you guys still taking new clients? Are you willing to do this? So that's one thing to just constantly keep out there to the providers you work with and the interaction that you have with the different members of the community. That yes, we're all still there. We're all still providing a vital service, and we're still there to help people in their time of need. And like I said, though, I think that from what I've seen as a whole, the members, the amount of new people moving in, the amount of new people wanting to engage in new services has been down a little bit. But I think probably sooner than later, we're going to see a flood of new applicants and people that are going to need to be engaging in services.
Yeah. Thank you. You touched on something that's really important. There's just this kind of built-in tension to what we're doing. You have people in houses who are saying, hey, I'm not sure I want to grow our house by very much right now, given what's going on. There might be other reasons they're saying that as well, let's be honest. But on the other end of that, there are people with real need who are out there looking for spots. And as always, we don't have enough spots. And so there's this tension of helping the person who we don't know yet versus serving the people who we do know and providing safety for them. And those two things shouldn't have to compete, but at times they do. Okay, I'm done preaching, but it's a challenge. Travis, anything you want to add to the conversation that we haven't touched on?
Yeah, we've been, the one thing I would say is we've been looking for ways to get constructive criticism or actual feedback, and so we're launching a private or a new pilot program this week. It's definitely not cutting edge or anything, but we're going to be doing survey monkeys in the house via email with all of our residents and give them a platform to give feedback anonymously to the property. Questions are like, are you feeling like your needs are being met? Is this a safe environment for you? Do you have any concerns about employment? And we're starting with about 5 questions in the comment section. I wanted to get a better way to gauge actual house level feedback without putting in a person in a position where they feel like they're going to be cornered into a certain way of thinking or speaking. So that's the one thing that I think that we're going to try out to see if we can get a little bit of better finger on the pulse of what's really going on and during COVID and just in the houses in general. And that's it. So.
Good for you. It's a brave thing to do, but what a great outreach to residents. Fantastic.
Yeah, let's see how it goes. If I don't like the answers, we're not doing it anymore.
Sure. Well, I want to, as I said, let's open it up. And Justin, I don't know if you may need to unmute people. I had trouble unmuting myself, but if anyone has a question, if you want to just either pop on the screen and wave at us or enter it in the chat or whatever, or a comment, something that you feel like we haven't touched on yet that you'd like to hear more about or that you'd like to raise. We'd love to just make this a conversation for a few minutes. Go ahead. Justin, if you want to unmute. Perfect.
So, and Alan knows this, but we are in the process of just opening a recovery residence. So we're probably, we think this date keeps changing and changing, but we're hopeful for this fall. Mm-hmm. Do you guys have any recommendation as to how we would bring residents in? Like we were planning on having, double rooms. We're going to have 8 women in the house. How do you recommend we bring people? Because we're starting from scratch. So we do bring one person and have that person tested. I'm not exactly sure. What would you guys recommend?
Well, in the,
Yeah.
I would recommend, especially if you're starting from scratch and you're going to be bringing everyone in brand new. I'm not sure what area you're in, but
We're in Walla Walla.
You're in Walla Walla?
Yeah.
Do they have the drive up testing things over there in Walla Walla?
How hard is it to get testing?
What'd you say, Alan?
How hard is it to get testing in Walla Walla?
I do not think it's very easy in our community. I don't know if you can you, Justin, can you unmute Jackie, see if she can kick in here, because she's working with me.
There you go. Be interesting to know how, if you can get tested, it'd be great to get everyone a test before they came in. So at least, you know, at that moment in time, you don't have anyone who's infected.
And you know, I'll do a little bit more research on that. The last thing I heard was that we were, unless you had symptoms, they weren't testing people in our community.
Okay.
So, and I don't know if people are coming, if they're coming from incarceration or treatment. I don't know, are you guys seeing people from those places, or have they been tested while they're in jail or while they're in treatment?
It depends on your referral source. You know, if your referral source is whether you kind of hit it on the head. I'm sorry, I'm going to have to jump here quickly, but I wanted to answer your question. Your referral sources is going to be kind of, if you're getting people off the street or you know, private, you know, people coming into your house, then you're going to have to take a few more steps from a precaution level. I would think most of the guys that we're with have been in for the last 30 days. The other thing that, or some kind of facility, usually inpatient treatment or a diversion center or things like that. And we work with the social workers team. I try to put the earnestness back onto my referrals agencies, like, hey, we'll take this person in. What steps have you taken? You know, has this person been tested for COVID? And then, you know, you got to ask those questions, symptoms and things like that as well. So
Okay.
What do you think, Jason, about the phased approach of bringing maybe 2 or 3 people in at a time, maybe in 2-week increments or something like that? Do you think there's any wisdom in that, or have you guys talked about that in opening new houses in these last few months?
The new houses that we've been opening, kind of what we've been doing, where we will pull in usually one core member, what we will put in a house, sometimes 2 when we open a house. We have been trying to immediately fill up a new house half full with core members, and then start to work with the agencies and such. I think it would be a very wise suggestion to do, to start bringing the ladies in slowly. But then again, I can only imagine what it's like starting your first house, and the financial ramifications that you're going to have, and the need to get that house full to be able to make your mortgage payment, to pay all of the utilities. So I would suggest that you work closely, as Travis suggested, with the providers, kind of see where they're at, what they've done. A lot of the providers, for individuals that are doing outpatient IOP classes, a lot of them get tested. So that would be great. But for the individuals that are self-referral, that are coming from the streets and that are experiencing homelessness, I would definitely suggest that you find a way to get those individuals tested. I know down here in Tri-Cities, there's an organization that's called Lynx Healthcare, LYNX. You might see if they have a presence over in Walla Walla at all.
Okay.
But they have where a person can just pull up and be tested.
Bye, Travis. Thank you.
yeah, if you have any questions, shoot me an email. I'll help you as much as I can.
Okay,
Thanks,
thank you.
Travis. And the other thing I would add too is your health department may be really helpful to you to be able to say, hey, here's what we're doing. it's communal living. Hopefully they're on your side in terms of the need for the kind of housing that you're offering. My hope is that they could be allies in getting your folks to the head of a line somewhere. That might be worth, and that's just a good relationship for you to have anyway.
Yeah, and we've been working with our county health. I mean, they know all that we're doing and everything.
Great.
So I think that would be, yeah, I think they'll be good. Also, we do have a group of housing providers like our homeless center, the YW here in town. And I know they've been meeting pretty regularly about, hey, how do we navigate this? So probably if I plug into that meeting and see how they're doing it, that would be helpful.
Just another thought and a resource that you have over there that you might reach out to is Blue Mountain Heart to Heart.
Yep, we just met with them last week.
Okay.
So yeah, and they've got, I know, because they've got people that they would like to refer to us as soon as we can get our doors open. And I know that they'll work with us too. So
which means they may be able to help get the testing done on their end. They can use their weight to get some testing. So
I think it's trying to figure out that, okay, so we bring 2 people in and we test them, and then what if one of them is positive? So did they both need to quarantine and we don't bring any more people in until the 14 days? It just, I'm not exactly sure. So I guess that's probably what we have to do.
Yeah, most
probably.
definitely.
Yeah.
If you have an individual in your, if you say you bring in 3 people and for whatever reason, unfortunately, one of them tests positive,
Yeah.
all 3 of them are going to have to quarantine. You're definitely going to want that one individual to have their own room and to have their own private use of a bathroom, just to try and cut down on possible transmission, we'll say.
And the other thing is, I would require the test before they move in, so that you just don't immediately have a community problem. So again, they could test positive anywhere along the way, but my thinking is, boy, why wouldn't just make that as a prerequisite in these days.
And then can I ask this, if it wasn't COVID related, how would you bring people in? Because I mean, we don't want to automatically just boom, have 8 new women in the house. So you're like saying, bring those core, get like 4 core people in, and then slowly bring in another one. And
so Karen, you're definitely, it would be my suggestion that either you or Jackie or someone who has some experience in the clean and sober world will definitely want to be there and move in with these women right away to go over your policies, your procedure, your application, your newcomers pack, and kind of be there with them and mentoring them for the first 30 days. That's that's going to be imperative to your guys's program getting successfully started. If they don't have some sort of 24-hour mentorship, whether that's from one of you ladies, from an employee that has some experience, it's been my experience that it never works without good core support to start with.
Yeah. And we have, so we're going to be between a level 2 and a level 3. So we'll have a full-time recovery advocate, so who's on staff. And then we'll have a house manager somebody who will live on site. And so those will be in place as we get going, which I'm thrilled that we're going to be able to do. And luckily, we don't have a mortgage payment because we got leased a house for no charge for 10 years. So financially, I think we could make it a go of it, even if we had half of the people with some county funds and stuff like that.
Awesome.
Yeah, what Jason says is so true. What you set up as a foundation your first few weeks will determine your success or not over the long haul. So starting it off small and good is so much preferable to starting big and shaky.
Yeah, that has resonated with me, Alan, when we talked about trying to find that senior resident, our first one, and you talked about how important that was. Yeah, that's just been a good reminder that person, they're going to set the DNA for kind of
for the lifetime of the house, perhaps.
Yeah.
So, well, hey, go ahead.
Just a sec. I might have one other question. With having a recovery advocate coming in and out of the house with COVID, is that okay? Because they go home and people aren't necessarily quarantining. It's like they're coming to work. That's okay.
Well, you have to.
Go ahead.
Jason. Yeah, my sense is, so we're staffed and we have our staff come to work. We encourage our staff to be really careful about their interactions. And then our staff, again, are able to reiterate to our residents, hey, I'm coming in here. And so I'm counting on you all taking this seriously as well, and taking care of yourselves outside of the house when you have to go outside of the house, etc. And so it's a bit of a trust building thing. And so yeah, our staff come in and out. At the beginning, for a little while, we gave them really shortened hours and encouraged them to do outside meetings and conversations and so on. But now they're kind of back into the regular routine of being in and out. But you know, they're outside when they can be. It's just such a blessing. This is happening in the summer, at least so far. They're outside when they can be, and just trying to do, you know, have big open area rooms, that kind of thing. And it's you know, staff has decisions to make about how they take care of themselves.
Absolutely. Karen, just out of curiosity, when you mention the word recovery advocate, are you suggesting like a recovery coach, a peer-to-peer support specialist, or a sponsor?
Yes. And we already have that person picked. It's somebody who's in recovery, who's going to be working with the women. Yeah.
Awesome.
And she's had experience doing that. She worked for Star Project for a while and has done some of that. And so, yeah. And Jackie, I don't know if you know Jackie, but she's had years and years and years of experience working as, like, we use the term recovery advocate, recovery coach, peer. Yeah.
Awesome.
So I think I will wrap us up here. All I'll say about our future events is that we've got some innovative webinars coming up. It's all on the website, and then the in-person events we're good too. A couple topics that we haven't tackled before that we're gonna be one of them is funding your recovery residents. We're still researching that one. The state is working to replicate the loan fund that Oxford has had in place all along, and so that's really neat. But there are private grants, there are other kinds of support mechanisms out there that we want to be able to give some real concrete kind of examples and thoughts about. So that's one coming up. We're going to take another swing down the road at trauma-informed care. We didn't really get into a lot of detail on that one, and so we're looking forward to doing that for sure, with some help from our state folks. We're going to do another session on medications for opioid use disorder. Really looking forward to. We're going to have Jessica Blos from she is the state opioid authority, who wants to come and share some kind of innovative lenses through which to see things. We want to be practical on that one as well. Justin, what am I forgetting? I'm not looking at the list right now of sort of the innovative ones that we've come up with. Yeah, the other one is kind of what makes a recovery resident. So talking about environmental factors, some of those things that are kind of hard to measure, some of those things that Jason's been referring to today, just environmental kinds of things. In a house, we're going to try to sort of define that a bit and kind of get into the social model of recovery and what that means. So anyway, that'll be interesting. We're going to post this webinar so others will be able to see it. So that's why I want to make a pitch for future webinars as well. So as people kind of, as we wrap this one up, they'll know kind of what we're up to. It's all going to be on our website. And again, the in-person events are in flux. We're not sure when those will happen. Those might end up getting converted into a web sort of format. But we'll kind of play that by ear as the months drag along here. So any closing thoughts, questions, comments on this topic or in general before we sign off?
I just say, Alan, I so appreciate all these that you do. I have learned something at every one of these webinars. So thank you guys for putting them on. It's been very valuable for us.
Oh, I'm really glad. That's great.
And Karen and Jackie, though I work for Oxford House Incorporated and I'm a regional state coordinator, I've been doing this. I've been doing this now for the better part of 10 years. I've got 60 women's houses and 46 houses for women and children. As I mentioned, in a much smaller group here, I more than understand that Oxford House most definitely is not a perfect fit for every individual out there. There's many great housing providers out there that are doing many great things. I want to congratulate both of you for deciding to take the steps and open up this house. With that being said, I'm an open book. If either one of you ladies need help, have questions, concerns, don't hesitate to reach out to me. It's a small group. My number is 509-430-1155. If you need to get together over Zoom, if you want to get together and have a cup of coffee in a park, don't hesitate to reach out. Don't hesitate to reach out anytime. We're all in this together, and we'll all get through it together.
And we will have a cup of coffee in the park too someday soon, Jason. So that'll be great. All right, friends. Well, thanks so much. Good to be with all of you. And as everyone is fond of saying these days, stay safe and be well.
All right.
Thank you.
Take care.
Bye-bye.
Bye-bye.